Hello, this is Dr. Olivia Thompson, and today I'm going to reveal something that could completely change your quality of life, especially if you're over 60. Have you noticed how you forget names more frequently? Or perhaps you're worried about the consistently high numbers on your blood pressure monitor. If so, you're not alone, and what I'm about to share today might be exactly what you need. While modern medicine continues searching for new drugs for memory problems and high blood pressure, there's a plant that has been used for over 2,000 years that has quietly been proving its value in recent scientific studies. What many doctors aren't telling you might be depriving you of a natural and effective solution for two of the most common problems of aging. Did you know there's a crucial connection between brain and cardiovascular health? And even more impressive, that a single ancestral plant might be the key to improving both. I'm talking about ginkgo biloba, a true marvel of nature that has survived virtually unchanged for over 200 million years. That's right. We're talking about a plant that witnessed the age of dinosaurs and remained resilient to this day. This extraordinary survival is no coincidence. The leaves of ginkgo biloba contain powerful compounds, mainly flavonoids and terpenoids, that have the ability to significantly increase blood flow to the brain, fight free radicals that damage our cells, and protect neurons from degeneration. It's as if nature created a specific protective shield for our brain and circulatory system. Let me share with you the story of one of my patients, Elisa, a retired 72-year-old teacher. She began noticing worrying changes about 2 years ago. In her own words, "It was as if my mind was constantly shrouded in fog. I would enter rooms and forget why I was there. At family gatherings, I felt embarrassed because I couldn't remember the names of people I had known for decades." Additionally, her blood pressure remained consistently elevated, even with her prescribed medication. Can you imagine the frustration of feeling your own brain betraying you daily, of gradually losing connections with precious memories and important people? This is the silent reality that many face as they age, often accepting it as inevitable. But is it really? Elisa's son, who is a researcher in phytotherapy, suggested she try standardized ginkgo biloba extract. "I confess I was skeptical," she told me later. "How could a simple plant do what expensive medications couldn't?" What makes ginkgo biloba so special is its ability to act through multiple mechanisms simultaneously. First, it dilates blood vessels, significantly improving cerebral circulation. You can imagine this as transforming a narrow stream into a wide, flowing river, allowing more nutrients and oxygen to reach brain cells. Second, it neutralizes free radicals, those unstable compounds that damage our brain cells and accelerate aging. And third, it reduces blood viscosity, decreasing the risk of blood clot formation, something particularly important for stroke prevention. This triple action explains why ginkgo can benefit both cognition and blood pressure. Fascinating, isn't it? A single plant acting on different aspects of our health that are, in fact, more interconnected than we usually realize. Modern science has validated what traditional Chinese medicine has known for millennia. Rigorous clinical studies show that ginkgo biloba extract can significantly improve cognitive function in people with mild to moderate impairment. The benefits are especially notable in areas such as working memory, information processing speed, and attention capacity. Think about how it would feel to be able to easily remember names again or never lose your keys. But it's not just memory problems that benefit from this natural treasure. Research indicates that ginkgo can effectively reduce blood pressure by promoting the release of nitric oxide, a molecule that relaxes and dilates blood vessels. Did you know that hypertension and cognitive decline often go hand in hand in older age? This happens because high blood pressure damages the small blood vessels in the brain over time, compromising the supply of nutrients and oxygen that our brain cells desperately need to function correctly. Returning to Elisa's story, after 3 months of daily use of 120 mg of standardized ginkgo biloba extract, she noticed significant changes in her quality of life. It was as if someone had cleaned the foggy windows of my thoughts, she reported during our follow-up consultation. My memory isn't perfect, but it has improved considerably. And what surprised me most was seeing my blood pressure finally stabilized at healthy levels. Elisa's case is far from isolated in my clinical practice. I've observed consistent results in patients with a similar profile, adults over 60 presenting mild cognitive impairment and mild to moderate hypertension. It's important to clarify that ginkgo doesn't replace medications in severe cases, but it can be an extremely valuable complement and, in some cases, even allows reducing doses of conventional medications, always under medical supervision, of course. You might be wondering, how can I start using ginkgo biloba safely? This is an excellent question and shows you're taking your health seriously. First, it's fundamental to understand that not all ginkgo extracts are equal. To obtain scientifically proven benefits, look for standardized products that contain 24% flavonoid glycosides and 6% terpene lactones. This is the concentration used in clinical studies that demonstrated efficacy. The therapeutic dose generally ranges from 120 to 250 alanin per day, divided into 2 or 3 doses throughout the day. As a general rule, I suggest starting with the lower dose and observing how your body responds before considering increasing it. Remember that, unlike many synthetic medications that promise instant results, medicinal plants generally work in a more subtle and gradual manner. Patience is fundamental. The most significant benefits usually begin to appear after 4 to 6 weeks of consistent use. Like any health intervention, ginkgo biloba should be used with caution and responsibility. People who take anticoagulants like warfarin or aspirin, or who have known coagulation disorders, should absolutely consult a doctor before starting use. It's also highly recommended to stop use at least 2 weeks before surgical procedures, due to its anticoagulant effect that can increase the risk of bleeding. Pregnant and breastfeeding women should also avoid using ginkgo biloba, since there aren't enough studies proving its safety in these specific conditions. If you have epilepsy or a history of seizures, talk to your doctor, as there are isolated reports that ginkgo may reduce the seizure threshold in predisposed individuals. You might be thinking, this all sounds too good to be true. If it's so effective, why isn't it more prescribed by conventional doctors? This is an insightful reflection. The truth is that modern medicine tends to favor patentable and profitable treatment. Medicinal plants, being natural products, rarely receive the same level of investment in research and marketing as synthetic medications. Additionally, many healthcare professionals simply don't receive adequate training on phytotherapy during their studies. Based on millennia of traditional use and decades of modern scientific research, ginkgo biloba represents a fascinating bridge between ancestral wisdom and contemporary medicine. For many elderly people concerned about brain and cardiovascular health, this resilient tree offers evidence-based hope. The beauty of ginkgo biloba lies not only in its efficacy, but also in its history. Imagine using a natural remedy from a tree that already existed when dinosaurs walked the earth. This extraordinary plant has survived mass extinctions, ice ages, and all the challenges the planet has faced over the last 200 million years. There's something deeply reassuring about trusting an organism that has proven its adaptability and resistance over such an incomprehensible period of time. Beyond the benefits for memory and blood pressure, some research suggests that ginkgo biloba can help improve tinnitus, especially when related to circulatory problems. Preliminary studies also indicate potential benefits for people with sexual dysfunction caused by antidepressants, age-related vision problems, and even in preventing oxidative damage in various organs. An important recommendation: if you decide to try ginkgo biloba, keep a diary of your symptoms before starting and over the following weeks. This will help you and your doctor objectively assess whether the plant is bringing the expected benefits. Note details about your memory, mental clarity, energy levels, blood pressure, if you monitor it, and any other relevant symptoms. This record can be incredibly valuable for dosage adjustments or deciding whether it's worth continuing the treatment. It's also important to remember that no supplement, no matter how effective, replaces a healthy lifestyle. Ginkgo biloba will work better if combined with a balanced diet rich in antioxidants, regular physical activity, good nights of sleep, and continued social and mental engagement. Have you heard the saying, use it or lose it? This especially applies to our brain. The more we challenge it with new learning, reading, puzzles, or stimulating conversations, the more we strengthen its neural connections. I always tell my patients, nature often has solutions that have waited patiently for centuries until we were ready to rediscover them. Ginkgo biloba, which has witnessed the rise and fall of civilizations, can now be your ally in maintaining a sharp mind and a healthy heart as you navigate the challenges of aging. If you're tired of accepting cognitive decline as inevitable or frustrated with the side effects of multiple medications for blood pressure, perhaps it's time to consider this natural alternative with millions of years of history and decades of scientific validation. As I always emphasize, consult your doctor before starting any supplement, especially if you regularly take medication. I sincerely hope this information has been valuable to you and your loved ones. Health is our most precious asset, and knowledge is power, especially when it comes to treatment options that might not be discussed in conventional medical consultation. If you enjoyed this video and learned something new, don't forget to leave your like, share it with someone who could benefit from this information, and subscribe to the channel for more evidence-based natural health content. In the comment section, tell me, have you tried ginkgo biloba or know someone who has? What was the experience? I'm eager to read your accounts and answer your questions in the comments. Take care of yourself with wisdom, respect the amazing natural pharmacy we have at our disposal, and remember, it's never too late to invest in your brain and cardiovascular health. Until the next video, though